Pharmaceutical selling is different. Number one point
Yeah.
why it is different, the prescriber or buyer is an expert, because to whom we are
Sorry,
talking, buyer is an
I
expert.
didn't get it.
Let me,
Okay, expert. Yeah.
because we are dealing with the doctors.
Yeah.
Who are the doctors? They are professionals, they are experts. They have performed very well during their academics. They got
Yes.
great marks in lower levels, A levels. They have competitive amongst millions. Then they were able to get the MBBS, medical college admission, and then MBBS. Then they are continuously involved in the education, upgrading their degrees and etc. So
Yeah.
while I was preparing the session for you, so a different perspective, because different, we are dealing with the doctor.
Yeah.
For example, if we are involved in the insurance sales, so insurance salesman can discuss his product with any of the person. Either he is qualified, because
Yeah.
pharmaceutical, to whom we are meeting, to whom we are forcing or selling our product, they are doctors,
Yes.
highly qualified. So they are an expert. Keep this in mind. So, dealing with a professional and an expert, more balanced presentation is needed, which should match with the customer motive.
Yeah.
So, when you are
Like,
talking, please go ahead.
sorry.
No problem. So, while you are dealing with the normal, unqualified person, your stance
Oh,
is different. But if you're
yeah.
looking a PhD person in front of you, master's person in front of you, very qualified, so you will be very much careful in your words, in your behavior, etc. Right? So keep the
Yes.
nature in mind. We are dealing with the doctors. A more balanced presentation is needed, which should match with the customer motive. We will have a separate session on customer motives, the buying motives. Very interesting topic. Maybe in third or fourth
Yeah.
session, maybe. So
Well,
customer, another different point, customer is not the end user, because
it's the buyer. Yeah.
he's
Okay.
not a buyer even. He's a prescriber.
Okay.
You know,
Okay.
we are convincing
Prescribe.
him a medicine to prescribe. That medicine he is not consuming
Yes.
himself, he is prescribing it to the patient. Actual consumer
Like,
is who? Patient.
patient.
But we are
Patient
not,
is the end
yes,
consumer.
patient is the end consumer, but we are not dealing with the
And
patients.
no, we are dealing with
Do-
professionals like doctors
Doctors,
and surgeons.
surgeons, specialists,
Yeah.
medical specialists,
Right.
chest
And
specialists, etc.
GPs. Yeah.
GPs, general physicians.
Yeah.
So
Yes.
we are convincing them to prescribe our products. Very
Yes.
rarely we get direct in touch with the patients. Very rarely. In some of the cases, and diabetes products and nutrition products, we may get direct involvement with the consumer or the patient, but not
Yes.
with the all of the cases. Always remember, repeat visits are needed, so that if we are meeting him regularly, frequently, he can recall you, your product, features and benefits, etc., and he is compelled to prescribe it.
Even with feedbacks, like you need to know the feedback of the product that you sold to them,
Sure, sure,
right? Yes.
definitely,
Oh,
definitely. If he has prescribed
yeah.
your product, you meet him
Yes.
regularly, he gives you feedback that okay, he
Yeah,
has
he
prescribed
does.
your product, it was working good or not good,
Yeah.
or
Or
there was some
not good.
problem with this medicine.
Yeah, very true.
Maybe there is a
Yeah.
problem with the availability, that he has prescribed this medicine and the patient is unable to get
It,
from the market. So there are so many
yes.
queries. So you have to meet him regularly. That what is his
Yes.
feedback.
Yes. Yes.
So an effective selling equation covers number one, good product knowledge, selling skills, and number three, desire to excel. By desire, we means your attitude. You must have that selling attitude with you. If you have a very good knowledge, very good skills, but if you don't have a desire, you don't have a passion to prove, so it is zero. So we will be covering selling skills, some basic medical knowledge in this, and desire depends on the candidate, how much desire he has.
Deserted. Yes.
Formal selling can be divided into two types. Number one is direct selling and other is indirect selling. Direct selling is also called as personal selling. Pharmaceutical selling mainly falls as direct or the personal selling. Although in pharma selling the product is sold by a doctor, but since here medical representative personally meets the doctor on regular basis where he convinces him to prescribe his medicine to his patients.
That's direct.
Yes, directly meeting with the doctors. If we are not directly with
Yes.
the doctor, there could be another possibility that we can send him an email, we can send him some
Or a
letter,
phone
some other
call.
communication tools that this is our product. But he will read it out
Yes.
and keep it on the side.
Yes, very true. You need to be doing face to face.
Sure,
It's more effective.
it
Yeah.
is more effective, it is more technical, and maybe more difficult.
Yes. Yes.
So there are three major players in pharma selling. Number one, medical rep himself. Number two,
Okay.
the doctor. Number three, and the product. It means, first of all, medical representative should know what his strengths and weaknesses are. What are his development areas? Where he can improve? Do he has the basic skills and knowledge to meet with the doctor? Then, does he has the good knowledge of his doctor? By the doctor knowledge, we means we need to have more and more data or the information about our customer. What is this Facebook doing? What is this social media doing? What is this Google doing? They are selling their customers' data to others.
Yes.
Why? To know the consumer behavior. Different companies are consulting these companies. Okay, we need to have these sort of people. What is that group of people? How many people are in the age groups of 18 to 20 years, for example? How many males are there who are interested in cosmetics? How many of them are interested in weight loss? Because
Yeah.
when you are clicking any interest of your video or post, so it has been recorded and an algorithm is produced that Zulfiqar has these interests. Just like when you click the YouTube and it gives you videos of your trend. If you are touching
Yes.
more religious topics, there will be more religious videos. If you are touching entertainment, Hollywood, Bollywood, etc., etc. So whatever your trends, it has been recorded and it is producing you the same. Because you know how much, what are the major interests of your customers. So similarly, you need to know much more about your doctor. What are his interests? What are his timings? What are his habits? What does he like most? Because you are in personal relation selling, you have to make more relations with him. For example, if you have 100 people in your class, but there could be around 15 to 20 persons, very close friends, maybe 5 will be
Yeah.
much more closer,
Yeah.
because these 20 friends may share same interest. So you have good personal relation with them,
Okay. Yeah. Okay.
because you like to meet this particular person. Out of 100, these 20 people you like to work more, you are more friendly with them. There could be 10 or
Yes.
15 persons to whom you will not be like to meet him again and again. There could be
Yeah.
some clash
Okay.
of interest, there could be some clash of personality, there could be anything.
Yes.
So since doctor are in personal selling, you have to get personal relations with them. When we'll be
Yes.
sharing or we'll be discussing the buying motive, what are the different buying motives, there you will see much more importance of knowing your doctors.
Okay. Yeah.
Similarly, you need to know lot about your product. What are
Yes.
your product features? What are the benefits of those features? What are the indications? What is the disease pattern? Because if you
Yeah.
know good knowledge, product knowledge and disease knowledge, so you can have a very good discussion.
Yes.
So that is the point lacking nowadays in pharmaceutical industry. People are hired, they are not conducting good level trainings, they are not interested in the product knowledge. So when they sit with the doctor, they don't have anything to say, to discuss. So they
Yeah.
just come on the bargaining side. Advantages.
Yes.
Okay, for example, if a doctor is prescribing cephalosporin,
Yes.
first generation cephalosporin, and you have a product, third generation oral cephalosporin, that is Cefixime.
Yes.
So you must know
Yes.
what are the differences between first generation and third generation, what are his specific indication, what are his weaknesses,
Yeah.
then you will be able to discuss. Okay, cephalosporin is causing 42% diarrhea.
Yeah.
If you know this
Okay.
information, you may put it in a very balanced approach, very minimum. Doctor may be aware that there are more chances of diarrhea with the cephalosporin as compared to Cefixime. But he may
Yeah.
say, okay, on gram positive coverage, cephalosporin is much better than Cefixime.
Yeah.
So you must know what are your pluses, strengths, weaknesses of your product. But what will happen that a doctor is prescribing Cefixime and you are also taking your Cefixime with you, because here you cannot compare the indications or the diseases. So there you need
Yeah.
to know competitors. What is his advantages? What is his price? What are the overall services he is offering? So there you
Yeah.
have to differentiate in the same product class, right? So in
Yes.
pharmaceutical, three major components. What are those? Medical representative himself, doctor, and product.